Mr. Speaker, the minister knows very well that there have been significant challenges organizing, booking and distributing the first dose of the vaccine. And now more and more Ontarians are approaching the timeline to think about their second dose, and anxiety about how this is going to work is sinking in. Some people have received an exact date for their second dose. Others have received information that's more nebulous. Some have been given date ranges. Some have been given telephone numbers to follow up. Others have received absolutely no information whatsoever. Now the government has also ended the use of Astra Zeneca for second doses and provided very little information as to what that means for the hundreds of thousands of Ontarians who received it as their first dose. Needless to say, Mr. Speaker, the process for the second dose isn't looking like it's going to be much better than the first. So when will the government come forward with a clear plan and process to ensure all Ontarians understand how to receive their second dose?
To reply, the Minister of Health.
Thank you very much, Speaker, and thank you to the member for the question. Actually, there is a very clear plan in place that is rolling out very well. We have administered vaccines to almost 6.5 million people, which is over 50% of the population of Ontario over 18. In addition to that, we have 4.9 million doses already booked. Some for second doses, some for first doses. The plan is rolling forward. It is clear. If you have booked your vaccine, your second vaccine, your first vaccine, through the online booking system, you will already have your second dose booked. So the pharmacies have asked to use their own booking system, which is the system that they use for booking flu vaccines. We have directed them to book the second dose at the same time as the first dose. That is happening in most of the pharmacies, but not all of them right now, and we are working to get them to move forward with that so that everyone in Ontario, will know when their second dose is. With respect to AstraZeneca, the member is right. We have put a pause on further doses of AstraZeneca while we await the results of reviews to be done by Public Health Ontario or Health Ontario and Health Canada.
Thank you. Thank you. Supplementary.
Thank you, Mr. Speaker, and thank you for the heckles from the Solicitor General. But what is clear, Mr. Speaker, is that not all pharmacies are booking the second dose. Pop-up clinics aren't booking the second dose. There are tens, if not hundreds of thousands of Ontarians who don't know when they're going to get their second dose. And now with the AstraZeneca situation, that number is only completely multiplied exponentially, Mr. Speaker. Everyone can understand that the science is evolving, but it's hard to understand how an important and meaningful decision that was made or announced yesterday could have been done without there being any kind of path or clear information going forward. The government has already elongated the second dose of the vaccination window, and so it has time to decide and to communicate. But communications isn't this government's forte. We all know that, Mr. Speaker. And just-in-time delivery, while it works for Amazon and Walmart, doesn't work for your health. So when will the government tell those hundreds of thousands of people who have already received AstraZeneca how and when they're going to get a second dose of the vaccine?
Minister of Health.
Very much. Well, I would just indicate to the member opposite that the vast majority of people aren't due to receive their second dose if they received a first dose of AstraZeneca until June, so that there is time for us to receive the information that we need to receive from Health Canada and from NACI with respect to the continued safety of AstraZeneca. The health and well-being of the people of Ontario are our foremost priority, and so we have them already in the system. We know when their second doses are coming up, and when it has been determined what the second dose should be, if it's not AstraZeneca, because we are awaiting results of the NACI determination of what's gone on in the UK, people will be informed. We have a system. We already have 4 million people that are booked for their second doses. We've already given 50% of the people of Ontario over 18 their vaccines. Clearly, the system is working.